It always surprises me how often the earliest signs of rheumatoid arthritis get waved off. And I'm not just talking about patients here, I'm talking about doctors too. Over and over, I'll meet someone in clinic who tells me their symptoms actually started a year ago, sometimes two, before anybody took them seriously. And by the time they're sitting across from me, they're frustrated and a little scared, wondering why nobody connected the dots sooner. So today we're going through the 5 early signs of rheumatoid arthritis that most people ignore. By the end of this video, you'll be able to look at your own hands, your own mornings, and your own body, and have a pretty good sense of whether what you're feeling deserves a closer look. And stick around, because sign number 5 is the one almost everyone gets wrong, and that includes a lot of really good doctors. If this kind of thing is helpful to you, do me a quick favor and hit subscribe and give the video a like. It honestly helps us get this in front of more people who need it. Before we get into the 5 signs, let's make sure we're all speaking the same language, because this part matters more than people think. Rheumatoid arthritis, or RA, is not the wear and tear kind of arthritis most of us picture when we hear that word. That's osteoarthritis, the kind that builds up over years of using a joint, the achy knee, the stiff hip, the knobby fingers a lot of us get as we age. Rheumatoid arthritis works completely differently. It's a systemic autoimmune condition, which just means your immune system, the system that's supposed to protect you, gets confused and starts attacking your own body. And in RA, it mostly goes after the lining of your joints. And here's why catching it early matters so much. There's something we call a window of opportunity in rheumatoid arthritis, an early stretch of time where treatment can change the whole long-term picture and head off permanent joint damage. Miss that window and we're playing catch-up. Catch it inside that window, and people can do really, really well. So this isn't only about naming symptoms, it's about timing. Okay, let's get into it. Sign number 1 is morning stiffness that hangs around longer than it should. Now, a lot of us are a little stiff in the morning. We're getting older, we roll out of bed, things creak, that's normal. But there's a very particular kind of stiffness in rheumatoid arthritis, and the giveaway is how long it lasts. With RA, that stiffness in your hands and joints can stick around for half an hour, sometimes longer, where you just can't move comfortably until your body finally loosens up. Now compare that to osteoarthritis. People with OA do feel stiff first thing, but when you really press them, they'll admit it's only a few minutes, maybe half an hour at the very most, and then they shake it off and get on with the day. So start paying attention to your mornings. Notice the little routines you might have built without realizing it. The warm water you run over your hands, the extra few minutes before you can grip your coffee. How long does it actually take before your hands feel like your hands again? That number tells us a lot. Sign number 2 is symmetry, and this is a really powerful clue. Rheumatoid arthritis loves to be symmetrical. What I mean is, it tends to hit both sides of the body at once, both hands, both wrists, both feet, instead of just one random joint here or there. And it has its favorite spots. RA goes after the small joints, especially the big knuckles where your fingers meet your hand, what we call the MCPs, or metacarpophalangeal joints, and the middle knuckles of your fingers, the PPs, the proximal interphalangeal joints, and very commonly the wrists. Honestly, it's pretty unusual to have rheumatoid arthritis and not have your wrists involved. So if you're noticing pain and swelling showing up in the same joints on both hands, like mirror images of each other, that pattern should raise your eyebrows. Osteoarthritis is often more scattered and one-sided because it picks on whatever joints you've used the hardest. RA likes balance in the worst possible way. So sign number 3 is swelling, but a very specific kind. This is one of the biggest ways we tell rheumatoid and osteoarthritis apart, so listen closely. The swelling in rheumatoid arthritis comes from real inflammation inside the joint, fluid building up, and the soft tissue around the joint getting puffy. So when you feel it, it feels soft, almost squishy, and it can feel warm or even hot to the touch, and it's usually tender. Now think about osteoarthritis. Those knuckle changes in OA come from the bone itself getting bigger over time, so they feel the opposite. Hard, bony, cold. So here's something you can do right now. Gently feel your knuckles. Are they hard and knobby, or are they soft, warm, and a bit squishy? And I'll be honest with you, true joint swelling can be tricky to pick up even for us. It takes practice, so don't panic if you can't quite tell. But soft, warm swelling, especially on both hands, is a flag we take seriously. Sign number 4 is the one people almost never connect to their joints, and that's fatigue and just generally not feeling like yourself. Here's the thing we keep coming back to. The root problem in rheumatoid arthritis lives in the immune system, and it just happens to show up in the joints. Because the whole immune system is fired up, the inflammation doesn't stay politely in your hands. The inflammation of RA feels a lot like the rundown feeling you get when you're fighting a cold or the flu, so it's completely normal to feel wiped out, foggy, and just off. I see this difference in clinic all the time. Someone with hand osteoarthritis usually tells me they feel good in themselves, they're just frustrated because their hands are holding them back. Someone with rheumatoid arthritis tells me a different story. Yes, the hands hurt, but they also feel sluggish, run down, foggy, not quite themselves. So take stock of your energy. If your joint pain is showing up next to that bone-deep tiredness, that combination is telling us something bigger is going on than just the joints. And now sign number 5, the one I promised you, the one that trips everyone up. Early rheumatoid arthritis often comes and goes, and it moves around, and that's exactly why it gets missed for so long. People expect arthritis to be constant, so when their symptoms flare for a week and then fade, they breathe a sigh of relief and figure it was nothing. Maybe they slept on it funny, maybe they overdid it in the garden. But in early RA, that on-again, off-again pattern, where the pain and swelling show up, settle down, then come back, sometimes in a totally different joint, is incredibly common. One week it's the knuckles, a few weeks later it's a wrist or an ankle. Because it isn't constant, and because it wanders, both patients and doctors talk themselves out of it. And there's one more piece to this one, family history. Autoimmune conditions tend to run in families, so if a parent, a sibling, or a grandparent has rheumatoid arthritis or any autoimmune disease, that bumps up your odds, and it's worth saying out loud because it changes how seriously a coming and going joint pain should be taken. So let's say you've gone through these 5, and a couple of them are hitting a little close to home. What do you actually do? First, don't spiral, and please don't diagnose yourself off one sign, because like we said, a lot of these clues overlap, and you have to look at the whole picture. What you can do is take inventory. Note how long your morning stiffness lasts. Notice whether it's symmetrical. Feel whether the swelling is soft and warm. Check in on your energy. Track whether things come and go. Then take all of that to your primary care doctor and ask, by name, about 2 blood tests, the rheumatoid factor and the anti-CCP antibody. Those are the labs that help point toward rheumatoid arthritis, and asking for them directly can save you months of going in circles. If the picture's pointing that way, you want a referral to a rheumatologist, because RA does best when it's caught early and managed by a specialist, with medicines that calm the immune system alongside anti-inflammatory lifestyle changes. And that last part is where I always like to land, because it's so easy to forget. Even with something as serious as an autoimmune condition, the foundation underneath everything still counts. Restful, regular sleep, movement that gets your heart going, keeping a lid on stress, because stress is like throwing fuel on the autoimmune fire. The people you surround yourself with, the way you eat, none of that replaces proper medical care, but all of it supports it, because at the end of the day, your joints, your immune system, your sleep, your stress, and your mind really are all connected. If this helped you make sense of what your body might be trying to tell you, hit like, subscribe, and share it with anyone you know who's been quietly worrying about their hands. And if you want to go deeper, I'll point you to a video on rheumatoid versus osteoarthritis right here. Thanks for watching, take good care of yourself, and I'll see you next time.